Alright, so today we're going to be testing the cranial nerves 1 through 12. We'll start with cranial nerve 1. It's the olfactory nerve, is for smell. So patient, have you experienced any changes in smell?
No, I haven't.
Are there any odors that you feel like you can't appreciate anymore?
No.
Alright, good. So the next cranial nerve we're going to test is cranial nerve 2, so that's the optic nerve. So go ahead and cover up your left eye for me. And look out there, tell me what letters you can see.
OHP and TZ.
Good, try it with your other eye.
ORZSKD.
Alright, good. So both eyes can see adequately. The next nerve we're going to test is cranial nerve 2 and 3 with pupils. So we test this in dark and light illumination, looking for anisocoria. Then we'll move in and check for the actual corneal or the pupillary reflex. Alright, now looking for an APD. See none. So the next one we're going to test are 3, 4, and 6, all the nerves that go to the different muscles in the eye. So now go ahead and follow this light with just your eyes and tell me if you ever feel any pain or if you see double. Alright, perfect. So now the next nerve we're going to test is cranial nerve 5, the trigeminal nerve. There are 3 main branches, so we're going to go ahead and test all those. So tell me when you feel it.
Feel it.
And now?
I feel it.
What about now?
Feel it.
And now?
Feel it.
What about now?
Feel it.
And now?
I feel it.
Alright, and now we're going to test corneal sensitivity here, which is also part of cranial nerve 5. So tell me, go ahead and blink whenever you feel it. Okay? One more. Good. Alright, so now we're going to test cranial nerve 7. So go ahead and show me your teeth. Alright, now scrunch up your forehead and look up. Good. Alright, and so now we're going to test cranial nerve 8, which is going to test for hearing. So go ahead and look out there and tell me when you hear it.
I hear it.
Good. And now?
I hear it.
Perfect. Alright, and now we're going to test cranial nerve 9. 9 and 10, so we're going to test for the gag reflex. So we don't have a tongue depressor here, but I would have the patient stick out their tongue and depress it and to check for a gag that would signify whether 9 and 10 are working properly. So now for cranial nerve 11, I'm going to have you lift up your shoulders. I'm going to push down. Try not to let me push them down. Good. Now look over to the left and to the right. All right, very good. So we're seeing the sternocleidomastoid contract on both gazes, as well as the accessory muscles in the shoulder working properly. All right, and so lastly for cranial nerve 12, the hypoglossal nerve, we're going to have you go ahead and stick out your tongue for me. All right, move your tongue to the left, to the right. Now stick it in your mouth and puff out your left cheek and your right cheek. All right, everything looks to be working properly. All cranial nerves are intact and functioning.